Welcome back. In today's session, we will discuss about a homeopathic remedy called Flouric Acid. The common name of Flouric Acid is hydrofluoric acid. It is proved by Dr. Herring. It is indicated by the symbol HFL. Okay, hydrofluoric acid. Commonly, it is known as hydrofluoric acid. It is a colorless liquid. So, this hydrofluoric acid is a colorless liquid. You can see in the picture here. It is a colorless liquid which is obtained by distillation. So, you can see the process of distillation, and we are obtaining by this process of distillation, we are obtaining the hydrofluoric acid. It is a strong irritant and it causes burns. When it acts on the tissues, it acts as an irritant and produces burns. It is a deep and long acting remedy. Flouric acid is a deep acting and a long acting remedy. Sphere of action, the hydrofluoric acid will act on the skin. You can see in the first thing we have the skin here. It acts on the skin. It acts on the skin, followed by the deeper tissues. Skin, and we have this deeper tissues where the fluoric acid acts. It acts on the bones and it acts on the veins. Okay, it acts on the veins, bones, and skin and deeper tissues. Clear, guys? So we see it acts on the skin, deep tissues, veins, and bones. Pathogenesis. So, acting on the skin, it causes ulcers of syphilitic nature. So, how are the syphilitic nature ulcers? Those ulcers will be very destructive in nature. They have a caseous, that is cheesy like offensive putrid discharges coming out of it. The offensiveness is marked in cases of syphilitic ulcers, destructive in appearance. So its action on the skin, it causes the ulcers which are similar to that of a syphilitic nature. And acting on the bones, its action will result in caries and necrosis of the bone. So you can see in the picture here, the syphilitic ulcers, you can see how deep ulcers these are and how much destruction they have done. It is also affecting the bones of the skull, producing this caries as well as the necrosis and the death of the bones. Okay, the death is occurring. The gangrenous condition sets up in cases of the tissues, and we have necrosis in the bones. These syphilitic ulcers, you can see, they produce ulcers which are syphilitic in nature. It also produces the caries and necrosis of the bone. You can see the caries and the whole bone is necrosed and fallen off. The caries and necrosis of the bone. Much weakness and premature age is also manifested by fluoric acid. The weakness, there is profound weakness. All the acid groups have weakness as a characteristic symptoms. We are also dealing with fluoric acid here, one of the acid. So it has weakness with the premature old looking people, premature old age. They are not appropriate. Their facial expressions or the physical makeup is not similar to that of a young person. They look old, prematurely old looking. Okay, so you can see the picture here. The best picture I could found on the internet was this. We can see this premature old looking lady. Okay, she is the prematurely old looking lady. She might look like some 80 years old lady, but she will be some 25 or 27, but she will look like some 80-year-old aji. So this is how the presentation is gonna be. The constitution, the makeup of the body, the premature old age people, the young people who look too old. Then you have to think of fluoric acid. Okay, one of the beautiful remedy in our materia medica for the people who are prematurely old looking. Fluoric acid. Relation with the heat and cold. Now let us see what are the thermals. How are the patients thermally? Fluoric acid is neither hot nor chilly. They are ambithermals. Okay, they are neither hot. They are neither hot patients nor they are chilly patients. They keep pendulating between, they act like a pendulum between the heat and cold. They have a pendulum like character between the heat as well as the cold. Similar like pulsatilla. Pulsatilla is also ambithermal. You cannot tell whether the patient is hot or chilly. They keep pendulating between the two. He is less affected by the excessive heat of summer or the cold of winter. They are less affected. They are not too affected by the heat. They are not too affected by the cold. Very less affected by heat of summer and cold of winter. However, his troubles are aggravated by warmth. So but then we see most probably the aggravation is seen because of the warmth, and they are relieved by cold. Okay, most towardsly hot. Mostly they'll be hot, but basically what happens in Flouric Acid, they keep pendulating. The pendulum like character is seen between the hot and the cold. General aggravation from warmth and amelioration by cold. Moving further to the miasm. The miasm in cases of Flouric Acid, all the three miasms are covered in cases of Flouric Acid, that is psora, psychosis and syphilitic. It is covering all the three miasms, psora, syphilis and psychosis. Any miasm out of all of them or all the miasms of these three will be present in the background. So all the three miasms could be present or any one miasm could be present in them. So we have the three miasms. Let us just revise what does that psora indicate in the form of inflammation, and psychosis, there will be overgrowths. It is accumulative in nature. And we see the syphilitic, it is destructive, decay. Okay, the normal growth production, if it causes, it's psora. Okay, inflammatory growth. If it is overgrowth, excessively increased, then it is psychosis, over accumulation. Syphilitic, we know destructive, there is decaying. So here we see most of the complaints what we saw so far, it was syphilitic where there was decay, there was caries and necrosis of the bones. Okay, there was caries and necrosis of the bones we saw. Clear guys? So we saw here the caries and necrosis of the bones and the syphilitic ulcers. Okay, moving further to the guiding symptoms of Flouric Acid. Now let us see what are the main guiding symptoms in a patient which makes you determine, and it should match the symptom similarity of the patient, and then we indicate that the patient is a Flouric Acid patient. So Flouric Acid is especially suited to old people and who complain of old age, and also young people who look old and attain this premature old look. You can see in this person here, he has attained this premature old looking face. Okay, premature old. And also that picture I showed you, a beautiful picture of a girl, she was just 25 years but she looks like that of 70s or 80s. So this premature old looking people who come up with a complaint of premature old looking, and burning, unusual heat and acridity. Very important in Flouric Acid, there is burning, heat and acridity. The acridity, the corrosiveness, acridity, acidity will be more, the acid content. Okay, the acid, it is very corrosive, so it is acrid, it is burning and unusual heat. These are the words which are qualifying a great many symptoms in Flouric Acid. The discharges from the ulcers, the discharges from the eyes, nose are very much acrid, acidic and excoriating. Even the sweat is going to be acrid. So guys, this word acrid is very important. You can see in the eyes, so we see here that the eyes, the discharge from the eyes, you can see, let us zoom in the picture. So we see the discharges from the eyes, the discharges from the nose, and we have the discharge from the ulcer. Let us consider this as the mouth. Okay, there is an ulcer. So the discharges from the eyes, the discharges from the nose, the discharges from the mouth, irrespective of which place it is, the discharges are going to be very much acid. It will be very excoriating. So you can see the reddish and excoriation of the nose, of the eyes, corners of the eyes here. Okay, so because of this discharges which are very much acid, they are excoriating. Even the sweat of this patient is very excoriating. Although it's common to all the acids, there is weakness and debility which is running through whole drug in fluoric acid. Like I said, you weakness, debility, these are the characteristic symptoms of acid group. So since the fluoric acid is belonging to the acid group, there is weakness and debility in the patients. The pain of fluoric acid is very characteristic. It is lightening like pain. You can see here. What is the character of the pain? They have this lightening like pain in the organs. So we see it is very characteristic, and this lightning like pain, and on a small spot they have this pain coming suddenly, lasting for a short time, and it disappears very quickly. How does the lightning come, guys? It comes very quick. Have you seen these thunderstorms and lightning? How does it come? It comes very suddenly. It lasts just for a short time and it disappears very quickly. By the time you tell people, okay, just look at that thunderstorm, no, by that time that thunderstorm is gone. That lightning which comes, it comes suddenly, it lasts for a short period and disappears very quickly. So this is the characteristic pain in fluoric acid. It is a lightning like pain. When you write the word lightning, you need to describe what it means. It comes quickly, it comes very fast, sudden, stays for a very short period and disappears quickly. The other remedies which have the lightning like pain along with fluoric acid is Bellis burnis, Macphos. Okay, so we have Bellis and Macphos where there is lightning like pain. Next, we move further. The patient has an increased ability to exercise without any danger. So just like how we saw, they are not too much affected by the heat or by the cold. They have this capacity for the increased exercise without danger. This is very striking and unique characteristic of fluoric acid. Basically in the acids, when we think they are very sluggish, slow, do not desire to move, slightest exertion tires the patient. But here characteristic symptom in fluoric acid is they have this capacity to exercise without danger. The patient is less affected by the excessive heats of summer and cold of winter. This too is also a peculiar, symptom of this valuable remedy. Not being too much affected. The patient says, "No, doctor, I don't just get affected too much by cold. Even I drench in the rain, it doesn't affect me much. I don't blow dry my hair. Yet I'm fine. I don't catch cold." And then the patient says, in the cold winter season, he says like that. In the extremes, he says, "I work in the sun." The laborer, he says, "I work in the sun for hours together. I don't come up with any complaint." So these are the patients who are not affected easily by any changes in the temperature or the weather. Then you have to think of fluoric acid. For vicious bone diseases, in necrosis, caries. So the bone diseases we have already dealt with it, so I've not put any picture for you guys. We have studied about this. There is a caries and necrosis. You remember the picture? We had the skull there, and the caries and necrosis of the skull we had seen, and that is of the bones. And the we also thought that ulcers which were syphilitic ulcers. Following, we also have this fistulous openings, fistula lacrimalis and fistula in ano. So the fistula, what is a fistula? A tract which is connecting a blind tract which is connecting the two internal organs. This is an internal organ, this is another internal organ. When a tract it is connecting abnormal, okay, this is not some normal tract which is supposed to be present in the patient. When there is some abnormal tract which is connecting the two internal organs, it is known as fistula. So this fistula could be in the eyes, so the fistula lacrimalis, fistula in ano. You can see the picture here. This fistula in ano, there is an abnormal tract or an opening. This is the external opening of the fistula, and this is the internal opening. This is the tract. Okay, you can see this fistula in ano. In calcareous degenerations, fluoric acid is infallible remedy. Okay, there is a general aggravation by warmth and relief by the cold application, and ailments are from syphilis, abuse of mercury and silicea or the silica. So we see when there is an abuse of this mercury or silica or syphilis, when the patient is suffering with syphilis, then we have to think of fluoric acid. Very important, moving to the particulars of fluoric acid. The particulars, we are going to discuss about the ulcers in the first place. The ulcers will be of syphilitic or soric origin. They are successfully treated with the fluoric acid. Sulfurs either of a syphilitic origin, or if they are of a soric origin, they are well treated by fluoric acid. Old cicatrix become red and round edged and threaten to become open ulcers. So these old cicatrixes, so we see once the ulcer forms, there will be scarring. Okay, this profound cicatric will be formed with this fibrous tissues, collagen, and everything. It will cover up, and the cicatric will be formed. It shows that it is an old ulcer. Now, this cicatrix will be threatening to break open and resulting in again an open ulcer in cases of fluoric acid. So we see what have they written. The old cicatrix will become red. They were supposed to be dead tissues, like all necrosed one. But here what happens? These ulcers will threaten to break open again. The old cicatrix will become, first they will turn red, and they'll become round edged, and they'll threaten to become open again. Varicose veins and ulcers in obstinate and long standing cases. We also have this varicose veins. It acts on the veins, right? So it produces varicose veins and ulcers, venous ulcers. So we see in the legs. Okay, we see in the legs we have this varicose veins, the varicose veins and ulcers on the medial aspect. Okay, so we have this varicose veins and ulcers in the long standing cases. So it's not an acute condition, these varicose veins. Chronically the patient stands, who does this profession of wherein they have to stand for a prolonged period, then the pooling of the venous blood occurs, resulting in varicose veins. So the varicose veins and ulcers in long standing cases in the women who have borne many children are admirably dealt with fluoric acid. So see, the varicose vein in the women who have borne many children. So the women, okay, multiparous women, she who has borne a lot of children in her life, okay, so born many children are admirably dealt with case of fluoric acid. The ulcers have round edges and vesicles. You can see the round edges of the ulcer. It is containing vesicles. Decubitus ulcers, that is, we have bed sores from which the copious offensive and acrid discharge. We saw it's a syphilitic ulcer. So how is the discharge in the syphilitic ulcer? Is going to be offensive, copious, acrid discharges are coming out. There is violent lightning like pain. The pains are confined to the small spot. They are aggravated by warmth and relieved by cold. So that's a point which is again repeating, which are aggravated. They are generally aggravated from warmth and they are relieved by cold. Clear, guys? I hope it's the modalities are getting clear by each slide. We're getting a better clarity. So all the caries and necrosis, especially of the long bones, whether they are soric or syphilitic, which are caused by, what are the ailments? They are the abuse of mercury and silica. It matters little to us whether it is mercury or whether it is syphilis or it is silicea. The main thing, if there are caries and necrosis of the long bones, satisfactorily you can tackle the case by fluoric acid. In cases of nervous children and capillary aneurysms, so we see in cases of navis of children, it's not nervous, it's navis. Okay, sorry. In cases of navis of children and capillary aneurysms, fluoric acid can be thought of as an effective remedy to give relief. Furthermore, for the exostosis of the long bones, bones of the face, caries of teeth, fistula dentalis, you can see the fistula dentalis here. Okay, fistula dentalis, fistula lacrimalis. Then fluoric acid is an infallible remedy. Modalities we have studied, it is aggravated by warmth and ameliorated by the cold application. So, with this, we come to an end of Flouric Acid. I hope all the points are clear. If you have any doubts, put them down in the comment section. And if you like the video, don't forget to hit the like button and subscribe.